This is Stephanie Telowetsky from Washington Area Bicyclist Association, and I'm just on today to introduce our afternoon keynote. So our afternoon keynote that we will be hearing from momentarily is Jessie Singer. Jessie Singer is a journalist whose writing appears in the Washington Post, The Atlantic, The Nation, Bloomberg News, BuzzFeed, New York Magazine, The Guardian, and elsewhere. She studied journalism at the Arthur L. Carter School of Journalism at New York University and under the wing of late investigative journalist Wayne Barrett. Jessie, we're so excited to have you here today. Go ahead and kick things off.
Thank you so much, Stephanie. I actually can't share my video either, but I think you can see my slides. So I guess you don't need to see my face, but I don't have permission to do that.
Trying to figure that out right now.
Okay, well, I can start talking and I might show up if that's what you'd like.
I think that sounds great.
Okay, all right, well, let's get started. As Stephanie said, my name is Jessie Singer, and I am a journalist and the author of There Are No Accidents, The Deadly Rise of Injury and Disaster, Who Profits and Who Pays the Price, a new book that was published this year by Simon & Schuster, and which I'm here to talk to you about today. In There Are No Accidents, I examined the deceptive meaning of the word accident and chronicle how the idea of the accident has been used by powerful people throughout history to explain away and distract from preventable injury, tragedy, and disaster. There I am. So today I'm going to talk to you about the deadly rise in traffic crashes and every other type of so-called accident, and why the word accident is more than inaccurate or misleading or toxic. I'm going to explain to you how "it was an accident" is a form of propaganda that historically and still today maintains a deadly status quo and has driven an immeasurable crisis of death and injury. So before I dive in, I have a disclaimer for you. I'm going to say the word accident today, and I'm going to say it quite a bit. Now, in my day-to-day life, I avoid using the word accident for all the ways that it masks preventable harm. Maybe some of you are like me and abstain from the word already. Maybe others don't call traffic crashes accidents, but use the word otherwise. Maybe you think word policing is dumb. And I'm not going to tell you what you should do either way, because having written a 300-page book on the word accident, I want to tell you that more than abstention, it's important that the word accident makes your antenna go up, that it makes you ask questions. So today I'm going to say the word accident, and you can listen for when it sounds wrong to you and when it sounds perfectly right. That will begin to tell you which harms you're willing to excuse as inevitable and which you're ready to fight. And I will try to help you understand why you should fight them all, why you should fight to prevent every single thing we call an accident, and why every so-called accident is actually one and the same. And right now, there are a lot of accidents that you can fight to prevent. Today, Americans are dying by accident more than any time in US history. And to understand the insidious nature of accidents in America, we need to start there. But first, let's clarify what we mean when we say accidental death. This is a broad classification that the Centers for Disease Control uses alternately with unintentional injury death. Essentially every way we die in America outside disease and intentional violence. This includes deaths from fires, drownings, drug overdoses, falls, traffic crashes, poisonings, choking, and a lot more. And these deaths have been rising. After decades of decline, so-called accidental death began to rise in 1992 and has risen more than 130% since then. We're talking about huge year-over-year rises of tens of thousands of people a year. And traffic crashes, what we're here to talk about today, are a big part of the problem. After decades of decline, traffic crashes have been rising in the US for over 11 years, from 35,000 in 2010 to 42,000 in 2020. The steepest rises have been seen among pedestrians and cyclists. As cyclists, as activists, as transportation professionals, in the face of such numbers, it can be easy to feel powerless, but I am here to assure you that you are not. Perhaps the simplest proof is this. While accidental death at large and traffic fatalities in specific are on the rise in the US, this is not happening in other wealthy countries. In fact, accidental death in general and traffic fatalities in specific are declining or static in our peer nations. There are a lot of specific reasons for that, but one general reason. By and large, these other countries treat accidents of all sorts as public health problems in need of interventions akin to those we make for diseases, such as preventative medicine and harm-reducing treatment. In the US, we don't do this. We treat accidents and injuries as a problem not of the environment, but of people. Bad people, distracted people, people making mistakes. Consider drug overdoses. Countries with the lowest rates of accidental overdose offer overdose reversal drugs like naloxone and safe injection sites. But in the US, every state in the nation instead puts people in jail for possession and drug-induced homicide. Or consider work accidents. Countries with the lowest rate of accidental death on the job require strict regulation of workplace safety and heavy fines on corporations that harm employees. In the US, to name one example, Amazon has been known instead to encourage warehouse employees to meditate, blaming injuries on their failure to be mindful. Or consider traffic crashes. Countries with the lowest rates of traffic crashes design roads to reduce speeding. In the US, we instead put up billboards telling people to slow down. You might wonder, why am I talking to you about drug overdoses and deaths on the job in the same breath as traffic crashes? I'm aware that this is a Vision Zero summit, but today we're going to look a bit beyond Vision Zero, and here's why. If we can do what other countries do, which is look at traffic crashes as a public health problem, we can actually start to solve the way the US fails at traffic safety. This is going to require a shift in mindset, but a very effective one. Because when we look at traffic crashes through a public health lens, we can see them as a problem of injury, a problem of fragile human bodies and the ability to withstand powerful energy. Through that lens, we can see that a traffic crash is really no different than a drug overdose or a work accident. It's kinetic energy or chemical energy or thermal energy, but the methods of prevention are the same. Control the dangerous energy, shield the fragile body from the dangerous energy, throw a pillow between us and whatever seeks to injure us. From this perspective, we can understand a more practical and actionable route to solutions. Consider this perspective shift. A safe injection site does not prevent people from taking too many drugs. It prevents the harm of taking too many drugs. Guarded machines and slow assembly lines don't prevent people from being distracted on the job. They prevent the harm of being distracted on the job. A narrow road designed to reduce speeding does not prevent people from crashing. It reduces the speed-induced harm of crashes. In the US, by and large, we don't think this way. And that is one reason why we lead the wealthy world in accidental death. Instead of focusing on reducing the harm of injury, we instead focus on behavior. This is to say, we fail to prevent accidental death because we think we can fix people, make them perfect, one by one. We focus on individual human error, the last person who made a mistake. In that, we miss the way that dangerous conditions stack up to cause accidental death and all the opportunities to intervene to reduce harm. And you can actually find some clues as to how and why we do this in the very definition of the word accident. Now, accident is a tricky word. It's vague. It makes things pleasantly unspecific. And that's why we use it to speak about so much disaster and destruction that we would rather not examine too closely. It's also contradictory in its very definition. In the dictionary, accident has two meanings and one contradicts the other. By definition, an accident is an unpredictable event. Also, by definition, an accident is a harmful event. So it is at once unpredictable with a predictable outcome. Now that's tricky unto itself. But complicating the word even further is that according to researchers, for most people, neither of these definitions come to mind when they hear the word accident. Instead of harmful or unpredictable, most people, when they hear the word accident, think unintentional. And this is at the core of everything we get wrong about accidents. When we hear about a traffic crash or a job site death or an overdose, we don't think that's harmful or that's random. We think that was unintentional. This is to say, when we hear about an accident, we don't think systemically about dangerous conditions or the harm caused or how we might control it. We think about individual human decision-making. Notably, however, while this focus on intention is the most common understanding of the word accident, when you break down the responses of that research by race and class, the numbers shift. People of color and people living in poverty are significantly more likely to say that accidents are actually intentional. So why is this notable? This is notable because the people who are most likely to be killed in accidents in the US, traffic and otherwise, are people of color and people living in poverty. Those most likely to see accidents as intentional are also the people most likely to die. Consider this. In the US, Black people die in house fires at twice the rate of white people. Indigenous people are struck and killed by drivers at twice the rate of white people. People in West Virginia, a poor state, are more than twice as likely to be killed by accident than people just across the state line in Virginia, a very wealthy state. Accidents are supposed to be random, unpredictable, and unintentional, but if that were true, accidental death would be randomly distributed across the country. It is not. Black and Indigenous people and people living in poverty die by accident most often, and this is especially true for those so-called accidents where policy and infrastructure make the difference between life and death. The safety of our homes, our workplaces, and our roads. Everyone here today is hyper-focused on roads and traffic, and you should be. But I would argue that we have a lot to learn about roads and traffic from thinking about so-called accidents more broadly. You might not see people dying in traffic crashes and fires as connected, but they are. They're connected by who is most likely to be killed, who is most vulnerable, who is exposed to the most risk, via policy decisions that create unequal infrastructure. For example, I mentioned the race-based differences in fire deaths and pedestrian deaths and how class differences affect all accidental deaths. But in contrast, everyone in the US accidentally dies by choking on food at almost the same rate. The same race and class differences do not exist in food choking accidents. Why is this? Because there is little that policy or infrastructure can do to make people chew slower. Most accidental death, however, is not like choking, which is to say that most so-called accidents are a matter of infrastructure and policy, not human error. Most accidental death is a matter of risk exposure, and we are not all exposed to the same risk. Dangerous conditions line up, and some people are exposed to more dangerous conditions. However, we often don't see these layers of risk exposure. Instead, we tend to think of accidents as a matter of personal responsibility. Now, depending on where you stand, you may dole out personal responsibility in different ways. You could be focused on how a driver was on their phone, or probably not someone attending this conference, but someone else could be focused on how a pedestrian crossed at the wrong time or how a cyclist ran a light. But these perspectives are actually one and the same, ways to say that a traffic crash is simply a matter of human error. After an accident, we're always looking for a simple cause, and the simplest cause is that a person was bad. Now, in a little bit, we're going to talk about how policymakers and corporations use this concept of bad people to avoid responsibility for predictable systemic danger. But first, it's important that we understand why you and I may think this way. Oversimplifying the cause of accidents to human error plays on some pretty natural and common psychological shortcuts. Let's understand this through a traffic crash. As with most accidents, questions of personal responsibility often follow a traffic crash. Was the cyclist wearing a helmet? Did the pedestrian have the light? How fast was the driver going? Was anyone drunk? You might have the urge to ask these questions. I'm sure you've read them in your local paper or heard them answered by a police source at the scene of a crash. At their core, these are comforting questions, not because they solve problems or prevent accidents from repeating. They don't. Rather, these are comforting questions because they separate us from disaster and tragedy. When we ask, what did person X do wrong? And we produce an answer, we're able to draw a line in the sand between ourselves and tragedy. This process of deciding who did what wrong is a way of telling a bad person's story. And this is super comforting because if you decide that an accident was caused by person X doing something wrong, then you've also decided that you are not person X, that you are not that you are good, that you would make better decisions under the same circumstances. This is a way of saying, it couldn't happen to me. Psychologists refer to this phenomena as the just world fallacy, the false but comforting idea that good things happen to good people, bad things happen to bad people, and the world is just. In our rational minds, we know this isn't true. But a mind coping with even a third-person experience of tragedy and disaster is not necessarily a rational mind. Related to this is another psychological trap known as the fundamental attribution error. This is the near universal tendency to blame one's own mistakes on the situation one faced at the time, and to blame other people's mistakes on their own personal failings. This is called the fundamental attribution error because we do it so universally, even in the face of all evidence to the contrary. So, to review, we tend to see other people's mistakes as caused by their personal failings. So, after an accident, we ask questions of personal responsibility. To separate ourselves from the tragedy, we decide if bad things happened, there must be a bad person to blame. All of this is a misleading distraction from our ability to solve the problem. But even extrapolated out from our own personal psychology, safety professionals have begun to define how these tendencies appear in the real world. And it boils down to two sides of a debate about what should be done to solve the accident problem. The debate goes like this. One side says that human error causes accidents and that to prevent accidents, we must fix people. And the other side says that accidents happen under dangerous conditions, and to prevent accidents, we must fix the environment. Either you can decide that a few bad apples cause accidents, or decide that if people are making mistakes and getting hurt, it indicates that conditions are unsafe. And these two sides really matter because they define what happens next. Whichever side of the debate you're on defines how you think we should solve the problem. If you think that the problem with traffic crashes is a few bad apple drivers, the purpose of investigating an accident is to find the human error and assign blame to the bad apple. Once whoever's in charge, say the police in this example, assign blame and hand out punishment, they can consider the accident solved. But if you think the problem with traffic crashes is that a road is dangerously designed, that the environment is unsafe, the purpose of investigating an accident is to identify the conditions that cause people to get hurt when someone made a mistake or a bad decision. Once the conditions are identified, they can be changed to prevent the accident from occurring again or to reduce the likelihood of death and injury when another person inevitably makes the same mistake. So if you think that traffic crashes are caused by human error and bad apples, then to prevent traffic crashes, you'd argue that we must fix people, which is quite a challenging proposition. But if you think that traffic crashes occur under dangerous conditions, then to prevent crashes, you'd argue that we must fix those conditions. Now, I'm firmly in the latter camp, and I think that you should be too, because as much as we pretend otherwise, we have decades of experience proving that human behavior is not really in our control. Hell, if you're a person who's ever set a New Year's resolution and broken it, you've got proof that even your own human behavior is not in your control. But we can control the environment. We can control the design of the roads and the design of the cars. We are in control of the conditions that people are exposed to, and that's all we need to prevent accidental death. For example, you are less likely to die in a traffic crash in Europe than in the US. And within the US, you're less likely to die in a traffic crash in New York State than in Texas. But no one would argue that Americans and Texans are worse people than Europeans and New Yorkers. The environments in these places are different. People are exposed to more risk there. Accidents happen when errors occur under dangerous conditions, but you can create conditions that anticipate errors and make those mistakes less of a life or death equation. Now, don't get me wrong. I know that people make mistakes and that human error can be a part of many accidents. The question that we're talking about here is how you react. Do you talk about how drivers are reckless and pedestrians are distracted? Or do you talk about why cars are allowed to go so fast? Or streets are designed in such a way that makes pedestrians hard to see? Do you punish the driver, or do you redesign the road? Do you try to change individuals' behavior or the wholesale conditions that all people live in? In answer to these questions, we can find the ability to predict whether or not the same accident will happen again. And it's important to note that a great deal of power resides with whoever gets to decide the answer to these questions. Now, I learned these lessons the hard way. Before I can go forward, I need to explain how I came to write this book and how I came to truly understand how the word accident worked. In 2006, my best friend, a 22-year-old New York City public school math teacher named Eric Ng was riding his bike on the Hudson River Greenway, which is a separated biking and walking path that runs along the west side of Manhattan. There, he was killed by a driver who mistakenly turned and entered the path and then drove downtown. That driver was drunk and speeding. He was obviously driving in a place he was not supposed to be. And he went to prison. And for a long time, that was the end of Eric's story. A drunk driver, an accidental turn. That was it. That was the end of Eric's story until 11 years later, when another man rented a truck and followed the exact same route as Eric's killer. But this time the driver intentionally turned onto the path. That driver killed 8 people and severely injured 11 in an act of vehicular terrorism. And that horrifying day pushed me to look deeper into Eric's death. And what I learned was that others had been killed where Eric was killed, before and after, on the same path. Now, every time, the drivers were different. Some were drunk, some were distracted, some were lost. But every time it was an accident, it was the story that was told. The whole narrative, that was it. It was an accident and no problems were solved. But after the terrorist attack, after an intentional act, the city and state got together and made the harm impossible. They barricaded every entrance to this path, so no car could possibly turn onto it intentionally or accidentally ever again. And that was when I learned that accident was this magic word of willful ignorance, and a way that we leaned on to ignore known and preventable harm. Look, let's be straightforward about what happened here. My best friend was killed by a drunk driver. That driver went to prison. This did nothing to prevent the same thing from happening again. More would die at the hands of different drivers under the same dangerous conditions. But the story that was told was that Eric died because of a drunk driver. The newspapers in the city and the state all told this story. It was a story that this horrible tragedy happened because of a bad person, and that bad people need to be punished. I believe we are all miseducated that this is the answer. Consider what it would take for this punishment to prevent what happened to Eric from happening again. Someone reading the paper, reporting on this man's arrest, would then remember it next time they're drunk and make different decisions? Even at best, that's an absurd idea. And at best, it's an extraordinarily roundabout route to prevention, when there is so much that we can do instead. To name just 2 examples, we could make the streets safe for drunks by providing accessible public transit. And we could use interlock technology to physically prevent drunk driving. Or we could just do what the city and state did after the terror attack, place a barricade between people and cars. None of this happened after Eric's death, because the story that we told afterwards distracted from our ability to solve the problem and to see the problem clearly for what it was. When we chalk accidents up to human error, we don't solve problems. And that is the singular reason why more people would die the same way Eric died. It is important to recognize that this is far bigger than our own psychological hangups. Governments, but especially automakers and other corporations, have been using this tactic to their advantage for decades. Consider this. In the US, in the second industrial revolution, worker deaths skyrocketed as industry grew. In response, workers began to consolidate their power into unions, and governments started passing regulations that put the onus and the cost of safety on industrialists. Then the industrialists came up with a propagandistic archetype of a bad apple, the accident-prone worker. The stories that the industrialists told was that workers weren't dying on the job because the job was dangerous, but because workers were accident-prone. Or consider this. In the US in the 1930s, the automobile became affordable and widely popularized. Cars were suddenly everywhere and traffic fatalities skyrocketed. In response, people in cities began to protest the danger of the automobile and tried to pass laws limiting the speed of cars. Then automakers came back with 2 propagandistic archetypes of bad apples, the jaywalker and the nut behind the wheel. The story that the automakers told was that people weren't dying in car crashes because cars were dangerous, but because people were jaywalking and driving like nuts. You'll note, this is the same story told twice. A preventable harm rises, driven by profit. People protest, and profit-driven corporations blame the problem not on the dangerous conditions, which the corporation created for profit, but on human error and bad apples. This appears in every industry, in every era, in every area of so-called accidental death, from apartment fires to pharmaceutical drug overdoses to the urban pedestrian traffic crisis. All these propagandistic archetypes are a way to say that accidents are caused by accident-prone people, distracted people, somehow bad people making mistakes and bad decisions. These tropes are pushed by corporations to enforce the idea that accidents are a matter of personal responsibility, but governments participate too. And I think this is something we saw after Eric died, when that road remained unchanged. But let's also consider this multi-million-dollar New York City Billboard campaign put out by the people in charge of designing and managing New York City's roads. This is a way for the government to say, this is not our responsibility. If you die, it's your fault or someone else's fault, but not ours. All of this presumes that people die in accidents because they make mistakes, not because of the conditions they face. Not because their roads are built for speeding and their cars are built for speed, but because of who they are. And this serves automakers and the government, because then they don't need to do anything. If we're all nuts behind the wheel, if we're drunk or jaywalking or otherwise bad, error-prone people, they have no responsibility to protect us from predictable harm. Real prevention requires seeing layered causality, the way dangers stack up. It's never just one person and one mistake. For example, why do people die on the roads? The answer is not just error, but layers of risk exposure. To name a few: the quality of their vehicle, the quality of the road, the quality of the other vehicle, the amount of sleep both drivers have had, the weather, the distance from a hospital, how long it'll take an EMT to arrive, and so forth. When we ignore all that nuance and make the question about people and their behavior, we miss so many problems we can solve. Here's another example. Picture two speeding drivers. One is rich and one is poor. One has paid $10,000 extra to get automatic emergency braking on their car. The other drives a 10-year-old clunker. Both drivers make the same bad decision, both speed, both crash, but only the poor driver is going to die. If we focus on their behavior, the poor driver still dies. If we focus on the conditions, like regulating automatic emergency braking in all cars, we can change the outcome. Two people can make the same mistake with different results. We can control the results. People are not perfectible. It is supremely hard to change human behavior, especially when the built environment encourages those behaviors. People make mistakes, people make bad decisions, and no amount of public service announcements and punishment is going to change that. But while people are not perfectible, there is hope because people are protectable. You can protect people if and only if you remember that they are not and will not be perfect. And we've actually made huge gains in the last 100 years in protecting people from cars, at least people inside of them. And there's a lot to learn from how we figure all that out. We're going to do a very fast history lesson now on the greatest minds in injury prevention, starting all the way back in World War I. Okay, so the first person I want to introduce you to is Hugh DeHaven. Hugh DeHaven is known as the father of injury prevention and the inventor of crashworthiness. He, of course, did not start out with such accolades. Here's how he got there. So in World War I, Hugh DeHaven was a pilot training in Texas when he was in a plane crash. Two planes collided in midair in a training accident. Both fell 750 feet. Hugh DeHaven survived with massive internal injuries, but everyone else died. Now, Hugh DeHaven was a smart guy, and so laying in the hospital, he wondered at the miracle of his lone survival. And later, when he was released from the hospital, he was able to examine the wreckage, and he figured it out. He wore a seatbelt. The latch on his seatbelt had caused his internal injuries. The plane had crashed into the ground, and then his body had crashed into the seatbelt. For everyone else, the plane crashed in the ground, and then they, not belted in place, crashed into the walls of the plane. He would come to call this the second collision. And this is what's really deadly. At the same time, DeHaven became obsessed with other so-called miraculous survival stories. He was chasing down these stories in newspapers and interviewing their miracle survivor subjects, other people like him with these crazy stories. And what he did was debunk the miracle. He began to calculate their fall impacts by their size and weight, the distance of their fall, and the nature of what they impacted. He also began to drop eggs on his kitchen floor. No, he wasn't crazy. He was changing what the eggs impacted and seeing how high he could drop them from and still keep their shells intact. In time, he determined that an egg could survive a 100-foot fall if it hit a 3-inch rubber mat. Between sorting out the math of the miracle fall survivors and what an eggshell could withstand, he determined that the human body could withstand massive deceleration, just as he had, if it was properly packaged. So it's important to understand a little backstory here. What Hugh DeHaven figured out was a revelatory idea at the time. Before Hugh DeHaven, for the first half of the 20th century, there was no notion that the machine, the car itself, could have an effect on whether or not you survived a car crash. The chief cause of dying in a car crash was understood simply to be driving like a nut. What happened in the 1940s and 50s was that Hugh DeHaven started to prove that the machine mattered. The box you were in when you smashed into a tree mattered. He would go on to redesign the airplane cockpit for crashworthiness, found the nation's first injury research center, and pioneer crash test dummy testing, and also to invent the 3-point seatbelt. This is when surviving injury as a matter of design enters the conversation. And this all changes the human error side of the accident debate. Hugh DeHaven proved that you can be safe, you can survive, even if you drive like a nut, even if you're a bad person. A few decades later, we're going to hop forward in time to a physician named William Hayden, and he would take Hugh DeHaven's ideas much further. Dr. William Hayden was the first administrator of the National Highway Traffic Safety Administration, the head of the Insurance Institute for Highway Safety, and the president of the Highway Loss Data Institute. So a veritable expert in accident prevention. And in 1970, he wrote an editorial in the American Journal of Public Health that would change how epidemiologists understand accidents. He called it On the Escape of Tigers. In the editorial, he argued that all injury in this world, intentional and unintentional, comes from the interaction between a fragile human body and some form of energy. You can trace every dangerous condition back to energy loosed upon the world. And prevention, he wrote, is about controlling that energy. And he used an escaped tiger to illustrate. We can control the harm of a tiger attack by controlling the release of a tiger, right? It's an extreme example and therefore informative because it forces us to reconsider how we respond to accidents. A tiger got out. Do you punish the zookeeper or design a better tiger cage? The correct answer starts with separating the presumed cause of the accident from the harm of the accident. Control the harm and the cause doesn't matter so much. We can control the ferocious energy of an escaped tiger by preventing the release of the tiger. And how do you prevent the release of a tiger? If you're focused on human error, you could train the zookeeper to hold tighter onto the tiger's leash, or fire the zookeeper, or tell the tiger it's a bad tiger. But personally, I would rather have a tiger cage. The point is that few would argue that you can change the nature of a tiger and that a zookeeper could learn to be stronger than a tiger. So you need to build an environment that can control a tiger. But by Hayden's account, prevention is not singular. You wouldn't just want a tiger cage. You'd want a tiger cage and a lock and a collar and maybe a moat. That is to say, preventing the harm of accidents requires redundant projections that address a wealth of dangerous conditions. By seeing the problem of accidents as not being about bad people or people making mistakes, but as about controlling energy, whether it's dangerous tiger energy or dangerous car energy, we can prevent the harm of accidents. So how does this apply to traffic? The way to reduce the harm of traffic accidents is by separating, in time and space, fragile people from giant steel machines. And there are so many ways to do this. By Hayden's model, injury prevention could be broken down into 3 distinct phases: modifying the energy source, modifying barriers between the energy source and vulnerable people, and modifying the people. And each phase is ripe with opportunities to change the outcome. Before a traffic accident, you can control the kinetic energy of a car with regulations requiring speed governors, for example. During the accident, you can separate the harmful energy from the fragile bodies with bollards and airbags and seatbelts. After, you can expedite emergency care. And these are just a fraction of the possible interventions you can take if you consider a traffic crash a problem of harmful energy released that needs to be controlled. If you consider it a problem of human error, you only have one intervention: fix people. So a decade after Hayden put forth this model, a psychologist named James Reason would invent a perfect metaphor to help us understand it: Swiss cheese. In this slide, you can see an illustration of the Swiss cheese model. The idea is that our transportation system, or any system where accidents occur, has layers of safety: government regulation of vehicles, road design standards, infrastructure funding, emergency medical care, to name a few. Today, many of those systems of safety have been shot full of holes. There are holes in our regulatory system, our hospital coverage, our roads. And through these holes, failures sneak through. Sometimes those failures line up, cascading until what results is a so-called accident. If we see a traffic crash is caused by human error and bad apples, say one driver who chooses to speed, we miss all the information in those layers of Swiss cheese and all the opportunities to arrest harm. Understanding layered causality in traffic crashes allows us to see how one speeding driver is actually the result of wide roads that induce speeding, and vehicles with the capability to go 0 to 60 in 3 seconds, and speed limits set by the 85th percentile speed instead of relative to safety concerns, and much, much more. And once we start to recognize the holes in the Swiss cheese, we can learn how to patch them. And in many places we have. You can see the ideas of DeHaven, Hayden, and Reason reflected in what's worked to actually drive down accident rates in the past. Chief among these is what happened when William Hayden, as the first administrator of the National Highway Traffic Safety Administration, applied the teachings of Hugh DeHaven to the first US vehicle safety regulations, requiring automakers for the first time ever to install seat belts, shatterproof glass, locking doors, and collapsible steering columns on all American automobiles, essentially building a better box for people to crash in. These innovations didn't prevent people from being nuts behind the wheel, but protected them, and traffic fatalities fell for 2 decades. Now, of course, none of these innovations protected people outside the car. And that's directly leading to the crisis we have today. But we can see this pattern of harm preventing effectiveness, of applying this thinking across industries. All right, consider the Triangle Shirtwaist Factory fire. After this massively deadly factory fire, worker deaths declined because the government created safety regulations governing the built environment of the workplace and used workers' compensation laws to put a cost on accidental death. Or consider airplane accidents. Air travel is the safest form of travel because it is the most regulated. Or even accidental child iron poisoning, which used to be quite common until the FDA regulated how iron pills were packaged, after which accidental child iron poisoning plummeted. With government regulation of industries forcing the creation of safer conditions, accidental death declines. Of course, as James Reason explained, accident causality is layered, and the physical protection of regulation is not the only way to patch the holes in the Swiss cheese. Consider our earlier discussion of race and class disparities in accidental death, and how this indicates that, excuse me, and how this indicates that we're not all exposed to the same conditions. Another way to say this: we don't all have the same number of holes in our Swiss cheese. While the width of a road or the regulation of automakers could be holes in the Swiss cheese, other holes could be how much a city spends redesigning streets in Black neighborhoods as compared to white. And another hole in the Swiss cheese could be where that same government chose to build highways 50 years prior. And another few holes in the Swiss cheese could be how much money you have, how far you have to drive to find work, and whether you can afford a new car or a car at all. As cars get bigger and heavier, the people who can afford them are more likely to survive a crash. Everyone else, poor people, are more likely to die. So when we look at what's driven down accidental death rates throughout history, we need to look beyond the physical protection of regulation as well. Overall accidental death in the US has declined with the rise of government regulations, but also with another equally important but less intuitive change that happened around this time. Union power drove shared economic prosperity supported by the creation and expansion of the social safety net. A rising minimum wage, Social Security, unemployment insurance, Head Start, SNAP, Medicare, Medicaid, Pell Grants, earned income tax credits, each of these programs contributes to a decline in accidental death. Here's why. If you have enough money in your pocket, you can take a safer job, you can rent a safer apartment, and you're more likely to buy a newer, safer car. So with all that big top-down federal change from the 1940s through the 1980s, accidental death declines and declines and declines. And then in the 1990s, something changes. Accidental death starts to rise. What happened started a few years before. President Ronald Reagan defunded the social safety net, one of the many factors leading to a new and yet unending rise in wealth inequality. He also defanged all those regulatory agencies, cutting their budgets, their staffing, and their ability to pass new safety standards. Every president since has been elected on a float of corporate cash and a deregulatory agenda. And this matters, it really matters. As regulatory agencies are defunded, we are all less protected from the danger in our cars, in our homes, and in our workplaces. And as wealth inequality rises, our roads and public places are in worse repair at the same time that the average American has less money in their pocket, is more likely to live in an apartment they know is a fire trap, or take a more dangerous job, or drive an older, less safe car, or not be able to afford that car at all. Today, more people die by accident than at any time in US history. Every year, the death toll grows. That's the big picture. That's where we're at. And traffic fatalities are no exception. Let's look at what is causing. Let's look at the layered causality, a James Reason moment. Here are just some of the holes in the Swiss cheese. Traffic fatalities are rising because cities are repopulating, rural hospitals are closing, people are driving older vehicles for longer. NHTSA is passing fewer vehicle safety regulations. Without regulation, vehicles are getting larger and heavier. And towns and cities are struggling to pay for road repair, much less what is really needed, road redesign. Now, this is a list of dangerous conditions. However, you note that the list did not include items like people are more distracted than they used to be, or there's been a rise in social deviance in the pandemic. Human error is not listed among the rise in traffic fatalities because the only way to systemically control the outcomes of human errors is by controlling the conditions that people are exposed to. Remember, to exceed the speed limit is a human error. A road designed to encourage you to exceed the speed limit, that's a dangerous condition. A vehicle without an intelligent speed governor, a doubly dangerous condition. The truth is that often on the road, people are making mistakes that you or I would have made just as they did because there was no other choice. We focus on human error after accidents, what one person did wrong. But if we care about changing the death toll, we need to refocus on dangerous conditions. This is how we make system-wide change. But today, departments of transportation are more likely to launch a billboard campaign than a road redesign campaign. Cars are getting bigger, heavier, and faster. And NHTSA has all but abdicated its role as a regulator. Automakers do not want regulations, so NHTSA does not regulate. So more and more people die, and NHTSA insists that the problem is that we all drive and walk and bike like nuts. That's a bit of a dark note, and I would like to leave you with a brighter one. To do so, I'd like to go back to our friend Hugh DeHaven and something that happened a few decades after his plane fell out of the sky and he started dropping eggs on his floor. What happened a few decades after that was that Hugh DeHaven witnessed a horrible car crash. In the crash, the driver was killed when a sharp dashboard knob pierced their skull. DeHaven was fascinated by what he saw as clear causality. The sharp dashboard knob was the mechanism of fatal injury. Excuse me. So the sharp dashboard knob was the mechanism of fatal injury. So he was inspired by this crash of this clear causality to examine more car-related injury. And he teamed up with the Indiana State Police Department and spent a year examining their fatal crash evidence photos, documenting the mechanism of injury. After a year, he had compiled a list of the most dangerous parts of every American automobile. Sharp, unpadded dashboards, non-collapsible steering columns that impaled the drivers, doors that sprung open in a crash. He hosted a private conference for automakers to present his findings. And he handed over his list to automakers. And he explained, he said, "This is how to prevent people dying in your cars. I figured it out for you." And they said, The automakers said, thanks, Hugh, we're on it. And then it was just crickets. It was crickets for 10 years. 10 years passed and hundreds of thousands died. Then, after a decade, Ralph Nader learned of DeHaven's research and starts to broadcast it. He publishes Unsafe at Any Speed, igniting an activist movement of people demanding protection from automakers based on the clear causality that DeHaven had found. In publishing DeHaven's research and thus lighting the flame, Nader made the problem of dangerous vehicles, previously a secret between automakers, public. In holding automakers to account, he made it possible for the public and the US government to do the same. And this, not DeHaven's research alone, but this uproar is what led to the creation of NHTSA and the passage of the first vehicle safety standards, which have since saved countless lives, and all of which responded to those clear causality points of harm that Hugh DeHaven found. Before Nader's intervention, before the people demanded better, car companies actually held the patent for the collapsible steering column, but didn't install it in their cars. When seatbelts were first proposed, Henry Ford Jr. insisted they were both technically feasible and so bad for his bottom line that he'd need to shut down the Ford Corporation entirely. You'll note that they're still in business. He was lying. Airbags were invented in the 1960s, but were not required in cars until 1998. This is the lesson I want to leave you with. No one in power is going to save us unless we make them. The lesson is that corporations and governments are never going to protect us unless we demand it. And we can demand it. And if we demand it, we can change the story. This is the work ahead of us. There are so many lives at stake, but there are so many ways, if we demand it, we can save those lives. Thank you very much. I think we might have time for a few questions.
Thank you so much, Jessie. Yeah, I think we do. If y'all could please use the Q&A function to submit any questions. It doesn't look like we've gotten any just yet, but I also didn't make that announcement at the beginning of this. Yeah, we'll give it a minute and see what y'all have questions about. Okay. Sorry, I'm trying to screen through these. One says, list a few items that can make our roads safer. Thoughts on that?
Yeah, absolutely. I would love to go back to those like injury prevention specialists we talked about. The whole idea of making our roads safer is separating us, whether we're a cyclist, a pedestrian, or a person in a car, from the harmful energy. And that harmful energy is the impact speed, the kinetic energy of cars. So any way we can separate people in time and space from that dangerous energy. So yeah, that's a protected bike lane. That's a sidewalk that's barricaded by bollards. Those are the physical interventions that split us from dangerous conditions. But we can also see big improvements by thinking in a smarter way about what people need and providing that separation in a more holistic way, like by building and expanding public transit. There are fewer people in cars and there are more people in a much safer form of transportation. And so that, that simple act of expanding the public transportation system, of giving people that resource and of making it cheap or free, will improve the safety on our roads. And I think we see the same thing with public bike share programs. Public bike share programs create a safety in numbers in the number of cyclists on the road and the ability to recognize and see cyclists. And so that has a huge improvement on safety. So I really think the answer is there are so many answers. There is so much we can do. I talked a lot about this in the presentation, but the simple regulation of our vehicles with all of these basic safety devices, many which are used in Europe and Japan, testing to see how dangerous our vehicles are for pedestrians and cyclists. Again, something done in Europe and Japan will prove which parts of the cars are most dangerous to people and will continue to reduce traffic fatality rates.
Great. Question from Courtney. How do you respond to the argument that addressing dangerous conditions is just too expensive?
Well, this country is much richer than most countries in Europe where they've already done this. So really, it's just a matter of how we're willing to spend our money. And currently, we spend a lot of money. I showed you that billboard from New York City. That was a $4 million billboard campaign, $4 million for billboards. But we spend a lot of our money on education and enforcement, and not a lot of money on engineering. So if we simply changed our priorities to what works, to a mindset of changing dangerous conditions over punishing people after they've made a mistake, we would have a lot more money to spare. But I'd also point you to a place like Hoboken. Hoboken has achieved Vision Zero. The city of Hoboken, it's a small to mid-sized city in New Jersey, and they did it cheap, they did it easy, they did it fast by simply looking at the points of conflict on their roads. Where were people getting hurt and injured? And doing basic affordable changes. They universally daylit every intersection. And is it perfect? No. Did they do it with Flexiposts? Yes. Do those get driven over? Yes. Have they reached Vision Zero? Also, yes.
Thank you. A couple of questions are all kind of getting at the same underlying question, which is, so we have all of this great information that you've shared with us today. And now how can we use this to see these outcomes that we want? How can we use this as an advocacy tool? Where can we go from here, essentially?
Well, I mean, I think there's a little bit of a lesson in the stories I was telling about like workers' compensation and union power, which is to say, you can't do this alone, but you're here with WABA, you're already organized. So like you have a unit now wherein you can demand change, because the only way that governments and corporations respond is to force, is to people-powered force. And so I would say, you know, you're already working in the best place you could be working. And it's just a question of taking these big ideas, these big lessons that were formed, you know, 50 years ago about what's going to make a change and applying them everywhere you can. And so you can take lessons like the city of Hoboken, or how vehicles are regulated differently in Europe and Japan, and push for those things here as an organized force, not as individuals, you know, complaining, but as a community of activists united behind common goals. And so I think that the best, you know, thing to do is to start to look at what is causing harm where you live. How are people dying on the streets? Which streets are they dying on? What's the deadliest road? Okay, great. That's your first project. You fix that road. And you do everything you can to fix that road. And then you start to work out from there. You start with the biggest harms, whether that's a street or it's speeding. You know, maybe the majority of likely the majority of traffic crashes that are deadly where you live are caused by speeding. Great. Can you change the speed limit? Can you institute an automated speed camera program? Can you do it everywhere? One actually great example of this that your city has recently introduced is an extremely high tax on SUVs. And one which I'm here in New York City and I tell everyone about. Did you hear what they did in Washington? Because what that's doing, that's not saying you're a bad person if you bought an SUV, or if you hurt someone with your car because you can't see them from your SUV, you're a bad person. It's saying that our government has failed to regulate these dangerous vehicles. These dangerous vehicles cause harm. And so we, as a group of activists, as a concerned community, are going to change how people relate to that harm and change how they're going to make those decisions about what vehicle they're going to buy. Would it be great if the federal government was doing this work for us? Yes. But what Washington, D.C. has done is remarkable, and hopefully will inspire the federal government to act to finally regulate these megacars.
Yeah, absolutely. Thanks for the little local shout out. Much appreciated. We have time for one more question, and then I'm going to go ahead and share out some announcements and details about the in-person gathering tonight. So last question for you. If attendees today who are elected officials, you know, in government positions, leave with one lesson and one action to take when they're back in office tomorrow, what lesson and what action are at the top of your list?
Well, not knowing what level of government those elected officials might be at, I would say that the most important thing they could do is to not just disavow the word accident. Let's go beyond the word policing, but to make accident a word that makes your antenna go up and makes you ask, has this happened before? Will it happen again? How can we prevent it? And from those questions, to start to reject not just the idea, but the spending and the budgeting on individualized solutions to problems. To reject the Billboard campaigns and the PSAs and the increased police traffic safety budgets in favor of real permanent change that changes conditions on the ground for everyone. I think that would make a big difference.
Absolutely. Thank you so much for that, Jessie. And thank you so much for being with us today. Everyone, this is Jessie Singer. As we mentioned,